2024. I'm Lynn Lakakis, and I'm here, and I'm going to call the roll. Mr. Ward?
Here.
Mr. Ethier? Mr. Fine?
Here.
Ray Joyce?
Here.
Mr. Coon? Mr. Simpson? Mr. Drake?
Here.
Mr. Grimm?
Here.
5 present, 6 present. Thank you very much. So the first order of business, actually, I would like to bat out of order, if we may, and look at number 5, which is 5795, confirming the appointment of the Commissioner of the Department of Social Services. We have Mr. Eames from the Executive's Office. Please proceed.
Thank you, Chairwoman. Thank you, Committee. It's my pleasure to bring forward the recommendation to appoint Aaron Sakowitz, Commissioner of the Department of Social Services. As Acting Commissioner of the Department of Social Services, Aaron is dedicated to developing and implementing policies and practices that will help the Department continue to achieve its mission on delivering services that support and protect families and individuals while encouraging self-sufficiency and personal responsibility. Aaron is most recently had been serving as the Executive Deputy Commissioner of the Albany County Department of Social Services and had been serving in Deputy Commissioner role since 2016, so for 8 years. Aaron's responsibilities have included overseeing the day-to-day operations for a range of social services programs and support for the Albany County's low-income and most vulnerable residents. Aaron also provides leadership guidance and support to 300+ staff. In addition, she also has provided administrative oversight for contract management and the development and implementation of technology initiatives for the department over the past years. Prior to becoming Deputy Commissioner at the Albany County Department of Social Services, Aaron served as an Assistant Director of Policy Planning, Projects, and Outcomes for the New York State Office of Aging, focusing on aging and long-term care initiatives. And previous to that, she was the Health Program Administrator at the New York State Department of Health, working on the development and implementation of the New York State of Health program. Preceding her roles at the state level, Aaron served as the long-term care coordinator for 7 years with the Albany County Department of Social Services, analyzing and making recommendations on the long-term care system for families. Aaron has decades of experience in local, county, and state government, which include working directly with vulnerable populations, and extensive background in aging and social service programs, the development, implementation, and oversight of various policies, programs, and initiatives designed to promote service delivery, efficiency, and effectiveness, as well as coordinating and successfully developing internal and external agency collaborations. Ms. Sakowitz holds a bachelor's degree in social work from the College of St. Rose and a Master's of Science in Health Services Administration from Sage College.
Very much. Ms. Sakowitz, did you want to say anything?
So I have a litany of things that I'd like to just outline, just so you can hear what my vision is, so you have a sense of where I see things going. Forgive me if I'm going to read a little bit. I just don't want to lose sight of what I want you to hear from me, if that's okay.
As you like.
But first, let me say good evening, Chair Lynn Lakakis and County Legislators. I appreciate the opportunity. I'm very honored to be nominated to be the Commissioner for the Department of Social Services by the County Executive's Office. As you know, our department is the ultimate safety net for families and individuals in Albany County. We dispense millions of dollars in assistance every year, including cash assistance, SNAP, and HEAP benefits, ensure access to health care through Medicaid, other employment, offer employment assistance, child care subsidies, and help older adults and disabled remain safe and independent in their homes. Our efforts are focused on the many federal and state mandates that we must comply with in the provision of our entitlement programs to individuals and families, which is not an easy task. There is often a misunderstanding that our staff who process eligibility applications are caseworkers. They are not. They want to help those individuals and families who come in for assistance, but the demands of conducting the work to process applications for entitlements does not afford us the opportunity, nor are they trained to be case managers. My vision over the next 5 years will be focused specifically on several key areas which I hope will increase our efforts to assist individual and families to move towards self-sufficiency while investing in our employees who will become more empowered and cultivate a positive culture change, which in turn will lead to better engagement with the people we serve. We are working with our community providers to rebuild our employment programs, to develop more vocational and work experience programs, connect with college and university training programs, and have these providers engage and assist clients in job readiness skills so they can secure and retain job employment, so they can be ready to move towards self-sufficiency. We're going to continue to programs for DSS clients who are unhoused or whose housing options are temporary or unstable, and refer them to programs such as the Rental Supplement Program, the Solutions to Homeless Program, which is also called STEP, shelter arrears, and other kind of eviction prevention procedures that are occurring in the community. We will develop and implement a pilot program for a family-centered case management team that will include hiring a client support program coordinator with a master's degree and several social workers, one of which will be case act credentialed. Our goal is to provide a level of case management that we really have not had an opportunity to provide in trying to help our safety net families to move towards self-sufficiency. We're excited about that opportunity. We're going to continue to work on the confines of the federal and state mandates that we're required to do and the regulations to assist our families and individuals. Some of the other intentional goals that we're going to have is to work on staff recruitment. Like most organizations, COVID kind of really wreaked havoc on our department, and so our staffing levels are much below where they need to be. We are going to continue to aggressively seek out ways to recruit and retain staff and provide some training to get them up to speed. Right now we have a 40% new hire rate, so our staff are not as educated or have the institutional knowledge that we previously have had. Also during COVID, our succession plan for leadership in our agency fell apart. So we're working on a multiple stage approach to kind of get that rebuilt and make sure that we have the leaders to move forward the agency in future years. We'll be looking at our workflows and leveraging any kind of changing technologies so we can then create efficiencies for our work that we do each and every day and also make it more efficient for the clients that we serve. We're going to work on collaborative solutions so we can enhance our partnerships in the community, so we can continue to find resources that will strengthen our ability to help individuals with their healthcare needs, their housing needs, and special needs such as mental health, alcohol, and substance abuse in order to make sure that vulnerable communities have the services they need. We're really going to work on our awareness and outreach efforts because many individuals and organizations don't understand what DSS can and cannot do. So I think it's important that we provide some education and awareness to help our community residents and our community partners have a better understanding of the work we can do, the resources that we can provide, and how to best access them. You know, DSS makes a significant impact on our most vulnerable populations each and every day. As we continue to work within the confines of our federal and state regulations and statutes and try to assist the individuals and families in moving towards self-sufficiency, we will continue to be faced with significant challenges going forward, which are bigger than just Albany County. So since the COVID pandemic has disrupted not only our workforce, but there's also a number of services gaps that are out there right now. One of them being affordable housing, employment programs, childcare availability, healthcare access, and substance use disorder and mental health treatment programs. There are limited options available for some of our individuals who have the most needs that come to look for entitlement programs for DSS. These systemic issues are not just Albany County's issues. They're issues seen across the country. These barriers make it difficult for some of our population to achieve self-sufficiency. It is important to note that DSS is not the entity responsible for correcting these systemic issues. However, our responsibility is to provide entitlement programs to help them maintain or work towards self-sufficiency, and we look to our partners in the community to develop ways to help our vulnerable populations with these other system issues. We work closely with other committees and work groups to provide input and feedback on what we are seeing and hearing and the need of our county and state legislatures. We need you guys to advocate and seek change at a higher level, at the state and federal level, to help us meet these goals. With that said, there's a lot to accomplish, and I'm sure there will be challenges, successes, and unexpected failures along the way. What excites and motivates me the most are the opportunities for my team and myself to do the work that DSS does very well every day. We look to continue to build and enhance our relationships with all community partners out there to identify best practices, new initiatives, new technology components, so we can together strengthen our ability to serve our most vulnerable populations and strengthen our community. I want to thank the county executive and his team, as well as each of you, our county legislators, for always being supportive of DSS and the work that we do. I look forward to working with each of you. Thank you.
Thank you very much. That certainly is got work cut out for you.
Yes.
Does anybody have any questions? Mr. Green, I was going to say, does anybody have any questions, Mr. Green?
Madam Chair, thank you very much. I emailed you a few days ago because I wanted to have time to kick around what I think is one of the most important things a county can do. Move more people from dependence to independence. And you've touched on that a little bit, and you're not the only agency that's responsible for that. I understand that. So one of the things I want to see is, can we at least count how many people we've moved from dependence to independence in a year? I've been asking for those numbers for 9 years. And the reason is, if you don't count it, then it doesn't count. So if we can just start to count the things and then identify the challenges, what would you say are the principal things that are getting in the way Because I feel like we're treading water. You guys work an awful hard every day. I feel like we're treading water. What is the path to this dependency to independence from your unique perspective?
Well, and I would say some of the things I touched on. I mean, right now, I think it's even more challenging since the pandemic occurred. I think the lack of affordable housing and people really being food insecure because of the cost of housing that they have. They're coming to us for all kinds of entitlement programs. They need SNAP, they need, health insurance benefits because it's too expensive. They don't have housing to live in, or they're being evicted because they can't afford rent. There are no work, job experience programs out there. During the pandemic, they all disappeared, so we're having to redevelop work experience programs so people can figure out how to learn some trades and learn some skills in order to get there. We're certainly engaging people every day in different job readiness skills, teaching them how to, function in a work environment, get their resumes ready, learn some of the skills that they need. Certainly those programs kind of dissipated over COVID during the COVID pandemic as well, and we're working to rebuild all of that. So I think it will take some time. I think it'll take a few years before we get back on track with that. We're trying to work with a multitude of partners, BOCES programs, different colleges and universities to kind of bring some of that skill set, education training back so we can get some of our people involved with that. I will say that, as the federal government and state government rules are changing, we may find that, currently we can sanction individuals if they're not meeting the participation requirements as part of our employment rules for temporary assistance benefits. That will be changing as we move forward. The state has asked for a waiver on that, so people are not going to be required to participate in employment programs as we move forward if the waiver is approved. That's a federal request that's being made. So I think, our goal is always to give them the tools that they need, the financial assistance they need on a temporary basis. Sometimes it's much longer than we expect. We're hoping that with the new team that we're piloting for the family centered case management, we'll be able to have more interaction with the families to kind of work with them and give them a little bit more intensive case management to get them to move from, getting from here to self-sufficiency. That'll be key for us, I think. This is the first time we're going to have a team of caseworkers that can focus specifically on this. So I think in time, we'll see how that works. It's very difficult, I think, to measure when people move from, entitlement programs to getting to be self-sufficient, because sometimes they're on the rolls, they're off the rolls. It's kind of a cyclical kind of thing. They might have a job for a while, and they don't ask us for assistance, but then they're back on again. So how do we define self-sufficiency, right? Is it that they're just changing jobs frequently and they are getting band-aided in between it all? You'd have to have a study that was done to look at that from a longitudinal perspective, and we don't have the capacity to do that. You'd have to hire a university probably to look at specific cases and get, IRB research accreditation to make sure that that could happen. That's not something we have the capacity to do.
I mean,
We can certainly tell you our participation rates, we're meeting the goals for participation for our individuals. They're participating in lots of job readiness skills right now while we're trying to work on work experience programs.
you talk about affordable housing. There's some people that can't, just because they have they can't handle it, living on their own, even if you hand them an apartment. And I think to break down the family, if we really want to go back to the real sources, is where there's no family support, they're left on their own, and they really aren't able, they're not capable, some people just aren't capable without some kind of skill trainer. I don't even know what the answer is, but I just know, I wish we count these things more so we have a greater idea of how well we're doing and how we can get better and work on the things that aren't working. All right, thank you. Thank you, Madam Chair.
You're welcome, Mr. Drake.
Oh, thank you. To further expand on that, is there anything that sort of tracks recidivism among temporary assistance benefits internally? If we did something like that, do you think that would help us identify programs that have higher efficacy versus lower efficacy, to sort of keeping people, as you mentioned, coming and going from temporary assistance?
I don't know how you would track that. That would be something that you really would have to look at and determine. If you're just looking at it from a temporary assistance perspective, I don't know, how are you looking at recidivism as a time period? Once again, you'd have to have somebody do that, determine how they could measure that and what that would look like. That's not something we can measure right now.
About a decade ago, when I was involved in the Housing Reentry Task Force and some of those other committees, not legislative, they were like community involvement committees. One of the things we talked about at length was the concept of financial literacy training and how that contributes to, I guess, using the same word, recidivism among people who are consistently having to come back for assistance. do you have any programs now that are part and parcel to receiving of temporary benefits where people are compelled to enter into some kind of financial literacy course, training, some kind of guide, something to help teach people? There's some people who don't have those basic skills, how to budget your money, or, the idea of expectations that bills are due soon for this and you're gonna earn money then, and, all those things like balancing a checkbook or whatever. Are you doing anything like that now?
So as part of our employment program, we had financial literacy classes that we could encourage our participants to, any entitlement recipients to participate in. Right now, we're struggling. We're trying to find financial literacy programs through some of the banking institutions to try to get them to help us move in that direction.
Is it that you don't have someone to teach it? Is that what you mean?
That's correct. And you can mandate certain things. We can't always mandate our clients or participants to some of these programs. So we try to, put teeth in it as much as we can and make it part of their independent living plan or whatever they have going on to try to get there. So hopefully that's something that we'll continue to work on as we move forward.
Well, it's one of the important themes that you stressed tonight is affordability of housing. And I think just as an observer and participant in that industry for many years, one of the issues is budgeting. And that sometimes, in particular, if you're at a lower income level that you're just barely making it or sometimes not making it. One of the reasons that I think some people end up in financial eviction as opposed to eviction for, improper behavior or violations or whatever, is that the common theme is that they don't plan for when the bills are due, and eventually, when you do that, other people lose their livelihood, and of course that results in a legal action. That's why I really constantly go back to that, because when you want to solve the issue of imminent homelessness that may be related to finances, a lot of it is simply timing of and or lack of participation in the payment process and the budget process, So I really can't stress enough, responding to what you're saying about the housing piece, that the more that we're able to educate people to work with what resources they have, to communicate, also to, to budget for at least some kind of payment toward whatever they might owe, the longer their stint in housing would be, because they'd be working with whoever that creditor might be. So it's just an opportunity, we rarely get a chance to interact with folks of your level in the social services world, and I just wanted to
And I
bring that
agree.
up.
I think, giving a financial literacy class to someone is probably not going to solve their long-term financial understanding of how to balance their checkbook and do what they need to do to meet their daily, needs of meeting their food, shelter, clothing needs, right? So, there are some programs, but they're not anything that DSS offers or provides, and nor do we have the capacity to do that. But, I think those are things that some of the providers in the community might be able to start to look at. But I think it's an ongoing process. I agree that is probably one of the biggest issues we have, is that people don't manage their money in the appropriate way to make sure that they're staying, self-sufficient and being able to maintain some of the things they need. Certainly, as we move forward, if there are programs out there that we can try to, find resources and funding or staffing capacity or something of that nature, we're always open to looking at that. Our goal is to always try to help the individuals that we're serving, right? That's the intent, so,
Thank you.
thank you.
Sam?
Thank you. I appreciate you sharing your vision for what you want to do with the department. And one, I want to say, I recognize there are a lot of challenges. It's a very difficult place to work. And I know there's a lot of state and federal regulations, so there's a lot of, some restrictions, obviously, on, what you can do to try to, improve outcomes there. But, considering that, we've heard a lot of concerns over the years in terms of the, quality of service people get, in terms of vacancies, which you brought up, which I know is, probably a large contributor to that level of service. And then issues such as, rental supplement program, which I understand is going well now, but for a while, we weren't, filling up those slots, and we weren't spending, we were leaving money on the table. So I just want to hear more about, what you'll do differently to try to, address some of these issues moving forward.
I think the staffing issue is not just an Albany County issue. I think it's a bigger issue. There's not enough workforce out there to take on some of these roles, and the younger generation is, very particular about what kind of roles they want to take on. things are getting better. We're doing very aggressive recruiting to try to get our positions filled, which hopefully, as we move forward in the next few months, that we'll see our staffing vacancies go down. That's our intent, and get the individuals trained and try to work on a training plan for them to get up to speed, since we have such a significant amount of new staff. You know, programs like the rental supplement program, you know, I think sometimes when you see these things, you know, we take great pride in the programs that we implement and try to pilot. And sometimes they take longer to launch than we would like, but we always want to make sure we're doing our best and make sure we're targeting the most appropriate people to get the help that they need and that it's going to be successful. Some of the other counties chose a different approach and did a fast approach of kind of pushing the money out the door. We didn't feel that that was the best way to do that. We felt like we could stabilize families and make sure that they're going to get the help that they need to maintain their housing over the long term. And I think we've done a really good job at that, although it was slow in coming. Sometimes that happens with implementation. So I think, you know, at this juncture, you know, we still have people coming on and off the program, but we're doing a really good job in trying to make sure we're expending the money and meeting the need of those who are eligible for the program.
Thank you. And I think I remember the commissioner saying with the rental supplement program that it was a vacancy issue, staffing issue as well. I think she said the person running it left a few times, and that was part of the issue.
We've had a lot of staffing changes. We've had a lot of turnover. I mean, if we have 40% new staff, what is that? I mean, that's quite a significant staff, and we still have a significant vacancy rate. We still have it close to a 30% vacancy rate in our agency. That's a huge, with the amount of work that we have coming in every day, it's very difficult to manage, and we're doing everything we can to ensure that people are being fed, that they're not losing their housing, that if we can put out temporary assistance benefits to stop an eviction or link them with, you know, legal aid or some other programs to make sure that we can help them, that's our goal. So yes, we're a bit behind in our work, but we're doing everything we can. Our staff is phenomenal in trying to keep things moving.
And, do you have any, beyond, you know, increased recruitment strategies, do you have any other creative ways to address these staffing issues? Maybe, you know, more opportunities for advancement. You know, some departments, I think the DA's office and public defender's offices have created over the years like steps so you can move up to different levels of public defender or
We have a lot of
ADA.
advancement opportunities. The
Okay.
problem is we're kind of squished in the middle. We have all new staff, so they're not eligible to be promoted. Certainly, we're looking at that from a civil service perspective to see if there's any way we can, you know, figure out ways to make that happen. But you have to have some experience. It takes someone at least a year to learn the job. Sometimes it takes 2 to really have a thorough knowledge of it. You know, it takes a long time. So we do have our middle, staffing levels is where we have the most gap, because we've had a lot of retirements. When COVID happened, we had a significant, and today, I had 3 retirements today.
Wow.
You know, of leaders, significant leaders. So that's huge for us, you know, so we're trying to make sure that we can move forward and continue to keep the boat upright and still serve the people that we are required to serve.
Do you think
Sandy,
that,
good?
can I have one more question? Do you think that, are the salaries in line with other comparable positions? And I believe we approved a new contract recently.
Yes.
Has that helped? I assume
Yes.
salaries increased in that
always helps.
contract.
The salary increases have always helped, so that's been huge for the staff and it, you know, so I think that's been really beneficial. You know, they'd always like more, I can say that, but most staff do, so.
I'd just like to remind us that we're all asking multiple questions, and we are almost out of time. So just have Patty and then Gil, and let's keep the ball rolling.
Okay, I'm not on the committee, but is that okay?
Fine.
Thank you. Just, first of all, I'm thrilled to death to see you rise through the ranks from your days in the town and working with seniors
Thank
to
you.
this position. It's wonderful.
Thank you.
It's wonderful, and knowing you, your ethics and your work ethic. The department's going to do well by you. Why, do you know the reason why young people don't want to come and work in social services besides the stressfulness of the job?
Well, it is a stressful job, and I think that, you know, a lot of times they're looking for higher paying jobs that, you know, our positions don't always warrant that particular level of salary that they're looking for. The other thing is a lot of the younger population are looking for hybrid. We're not quite at the hybrid stage. We have mandates to meet with people in person and do interviews in person, face to face. So, you know, our goal in the future is to try to get there. We are still a very much paper-based system, so it's very difficult to take the significant amount of confidential information we have in paper and move it to somebody's home to utilize. We have to be very cautious about that. So we're working very closely with our DIS team to figure out ways to move that forward and develop a plan. So hopefully in the future, that will be one of the perks that we can offer our staff.
Thank you.
Thanks.
I just want to let you know that I've been here since McCaffrey was commissioner. And in between now till then, these questions are very hard, very complex. But I want to say to you, I think you answer them a lot better than a lot of commissioners prior to you.
Thank you.
So with that, I'd like to make a motion we recommend.
Second by Mr. Joyce and Mr. Ward. All those in favor?
Aye.
Any opposed? Motion passes.
Thank you.
Good luck, Aaron.
Thank you. Thank you very much. Now let's get quickly run through the rest of what we have to do. Let's approve the previous meeting minutes. Have a motion. Mr. Drake, and second. Mr. Grimm, all those in favor? Items number 2, 3, and 4 are tabled at the request of entities, and we're the same word for that. Okay. Motion to adjourn? Mr. Joyce,
Second.
Mr. Ward, all those in favor?
We got extra time.
We got 3 minutes.
Oh, boy, we're gonna.
Can we ask another one more
I'm going to ask
Well,
my
you can
question.
go
Sam could love
one
both
after
of you.
her, yeah. Thank you. Thank you very much, sir. Let's go to my other chair over there.